Imagine like your 2-year-old, it's still building their foundation, and then you give them a course of antibiotics. You just wiped out their gut microbiome. Like you mentioned, there's a gut-brain axis. So some people will have mood disruption, brain fog, anxiety, things like that from poor gut health.
Yeah.
A lot of your serotonin is created in your gut.
Yes.
I hear this all the time. They get dismissed. I even hear my colleagues say these things about, oh no, she's just crazy, or, it's in her head. It's anxiety, all of these things, and they just get dismissed. But they don't realize that normal labs do not equal optimal labs.
Well, welcome, Dr. Tanya.
Thank you.
So happy to have you on.
Excited
I know
to be here.
We've been talking about this for a while, and I feel like every time we talk, it always is a good conversation.
Yeah.
It goes from 1 to 2 hours, and we talk about all things biohacking, longevity, gut health, supplements, even putting on muscle. So super grateful for you. I always tell my story to everyone I come in contact with. You're not only my friend, but also you're now my integrative doctor. So I hope to share my story with you and the audience. But I just wanted to go over who you are. So Dr. Tanya is the owner and founder of Ageless Medicine. Dr. Tanya is a board-certified physician associate who specializes in functional medicine, hormone optimization, peptide therapy, and clinical weight loss management. Dr. Tanya also creates personalized strategies and protocols. She helps with health-conscious adults optimize energy, metabolism, sleep, cognition, healthy aging, and all through practical environment-based telemedicine model. Did I miss anything?
No, thanks. Yeah, I just want to clarify though, I am not a physician. I am a physician associate. So I do have a doctorate in medical science. So different training, but I just want to make sure that that's clear.
Got it. Yeah, sorry.
It's okay. No problem.
So, so my story is that I had psoriasis. I was diagnosed in 2012. At the time, it started by my ears, and then went to my knees and then my elbows. So I went to a dermatologist and I got a biopsy done. And the dermatologist, sent it off to the lab, confirmed that it was psoriasis. And this was in 2012. And they were like, yeah, sorry, we don't know how you got it. There's no cure for it. And here's a cream of steroids you could take for the rest of your life. And by the way, if you want to do injections, we could give you shots, but you could get tuberculosis. But I'm a firefighter paramedic. So I'm like, yeah, there's no way. So that was in 2011, 2012. By 2016, it started taking over my whole body. So it spread to my shins, my groin, my chest, my stomach. And I was just so sick and tired of scratching until I bled. So I started looking up alternatives to the steroids and the other medication they gave me. So I found this guy on YouTube who had success with fasting, cutting out simple carbs, sugars, alcohol, beer. And 2016, I'm like, man, I don't know if I could do that. Well, I was at that point where I was so desperate that I said, okay, I'm doing it. So I started fasting, cut out the simple carbs, the sugar, beer, made a good improvement, but it did not eliminate it. So then that was 2016. Fast forward to, I believe was it 2023 or 2024? I can't remember.
Mm-hmm. Yeah, 24.
24, okay. And I remember I kept calling you and we're having conversations and you're like, I think I could pinpoint it and you might have leaky gut. And I remember telling you I think leaky gut's a myth. No one could prove it. And you're like, no, I could prove it. I think I could pinpoint it. So at that point, I remember thinking, okay, well, let's do it. Let's give it a shot because nothing seems to work. So you ordered the GI gut map for me. So if no one knows what a GI gut map is, basically you get a little French fry container.
Looks like an In-N-Out
container. You poop in it, send it off to the lab. Some people have asked me, because I've shared this story so many times, do you mail it back to Tanya? And I'm like, no.
They asked that? That's hilarious.
So mail it off to the lab. And then I remember when you call me, when I got the results, you're like, considering how healthy you are, I cannot believe how bad your gut is. I'm like, what do you mean? Okay, well, you have low stomach acid. You have zero akkermansia, which akkermansia converts polyphenols into antioxidants. And I remember you asked me, do you eat blueberries? I'm like, yeah, I just crushed a whole case of blueberries before I talked to you. I had zero probiotic. I had a stomach I had a parasite. I had staph in my stomach. I had low stomach acid, chronic inflammation, and dysbiosis. So you put me on a full protocol, and I believe that was in November of 24, 23. By, I think it was month 6, my psoriasis had eliminated completely. And I remember I sent you before and afters.
Yeah.
And I remember thinking at that time, like, okay, this is crazy. Like all these issues going on in my gut. I know that my gut is like my second brain. Immune system comes from my gut. I can't imagine how good I'm going to feel after I fix my gut.
Yeah.
But at the time I'm like, well, I'm doing everything right. Like, supplements, exercise, TRT, peptides. But one thing that I noticed is that it eliminated my brain fog, fixing my gut. So I want to get into talking about, all those things, the leaky gut, the low akkermansia, the low probiotic, but you put me on the supplements to correct me.
Yeah.
So.
Yeah. And you already made some of the diet and lifestyle changes that you needed to do. So that's always beneficial. It's not just like a supplement game when it comes to fixing the gut. So I think that's important too. For instance, I remember you told me you did like a elimination. It was like kind of like a carnivore diet or something, right? And that's kind of like a elimination diet. That's why people feel so like they get so much benefit from it. And I'm not advocating for like something like that. I just think that, it works well because it's an elimination diet. And then, when you start reintroducing things like, or when you actually do a carnivore diet, you end up not feeding some of the beneficial bacteria. And so what we saw in your gut was that a lot of the bacteria, like your good beneficial commensals, weren't growing. And so that was part of the problem, is like not feeding them.
Interesting.
That's why I asked about the blueberries.
Okay.
Yeah. So it's really interesting because when it comes to your gut, like you mentioned, 70 to 80% of your immune system is in your gut. And that is the one place I tell a lot of my patients that it's the one place where, you get a lot of exposure to the outside world, because what you eat, it's not like sterile, that goes into your system, and it has bacteria, it has like food and nutrients and stuff like that. And what your body is supposed to do is that when it comes to your gut, it's supposed to have like this lining, like a barrier. And through that barrier, it helps, like a coffee filter, helps filter in good nutrients, and it's supposed to keep out the bacteria, the food particles, and everything else. And what happens in leaky gut is that you end up getting kind of like holes, I guess, or there's disruption in the barrier, and some of these food particles and bacteria and things get into your system. And then, your immune system reacts to that because those things aren't supposed to be there. And so that's where we think sometimes a lot of the autoimmune diseases get flared up. And that's what we needed to do, is kind of reverse engineer that stuff, is basically your immune system's overreacting. That's why you're having flare-ups of your psoriasis, and then, trying to repair that barrier. That was like pretty much the goal.
It makes sense. So one thing I noticed with fixing my gut health, like prior to me coming to you, I felt like I would get sick every single time I was near someone with a cold. And I'm a firefighter paramedic. So flu season, I'm getting it. Anyone in my house who gets sick, I'm getting it. Now that I fixed my gut health and really focusing on it, it's a completely different story.
Yeah.
And then also, peptides too, like thymosin alpha, glutathione, KPV, BPC 157, those things help too. But fixing my gut health really improved my immune system.
Yeah.
So like for when it comes to leaky gut, what I read, and tell me if I'm wrong, is kind of like you were explaining with the coffee filter. So like the gut lining becomes so thin that the fluid inside of the intestines can leak into the body, or is it vice versa?
Both bacteria, the food particles, everything can leak in. And, your first line of defense in your gut is actually your gut microbiome. And they create things to help boost your immune system. And so that's your first line of defense. Your second line of defense is actually that barrier. And it's like a thin epithelial layer that is supposed to filter out the bad stuff and the good stuff, So it accepts the nutrients, and it's supposed to keep things out. And then your third line of defense in your immune system is your immune system. And when any of those things leak through, then you get that immune system activation. If you have leaky gut for a long time, or things are chronically getting through, you have this low-grade chronic inflammation, and that becomes problematic. I have not met anyone with autoimmune disease that has like a really good gut. They've always had gut issues. Even women with endometriosis or hormone issues, like gut health is so foundational, and it's hard for me to explain this to like a lot of my patients. I just gotta, get that in their head, because if you don't have good gut health, it has to do with everything. Like you mentioned, there's a gut-brain axis. So some people will have mood disruption, brain fog, anxiety, things like that from poor gut health.
Yeah.
A lot of your serotonin is created in your gut.
Yes.
And then other people will have like hormone disruption too. A lot of women with like estrogen dominant symptoms. This is, headache, breast tenderness, endometriosis, heavy bleeding. They also have like constipation and things like that. They always have gut issues too.
Yeah. So, no, I believe it. From the time like my gut was messed up to now, the brain fog has been eliminated. But also like my ability to stay focused is much better.
Yeah.
And then serotonin. So I get my blood work done every 3 months. My serotonin has been constantly low, and I take 5-HTP. I take other supplements to boost it, and nothing has worked until I started fixing my gut health.
Oh, you measure it?
Yeah.
I love that. That's really cool.
Yeah, I've been measuring my serotonin levels for the last 3 years through blood work.
Oh, that's cool. Yeah. Because the thing is like, if you don't have like the right gut, like you might not absorb everything. That's a problem for a lot of people, is that maybe they have like low acid in their gut, or they don't have like they have dysbiosis or whatever else, leaky gut, and their nutrients aren't getting into them. So even if they're taking supplements, they're still not absorbing the nutrients that they need.
Oh, that makes sense.
So that can be problematic. Yeah.
Okay. So, when it comes to leaky gut, the cure for it isn't as difficult as people think, because you put me on a high dose or just a regular dose of L-glutamine.
Yeah.
And that pretty much cleared it up. I mean, I use peptide therapy, like BPC-157, which is great for the gut lining, KPV, which is a powerful anti-inflammatory peptide. Those two together, I feel like make a big difference. But the L-glutamine really helped. Do you have anything else for that? Or?
Yeah, well, it depends on what's causing the leaky gut. So leaky gut can be caused by multiple things. A lot of times it's by, processed foods. Alcohol causes leaky gut really bad. And it can increase like LPS, lipopolysaccharides, which is not good in your system, causes inflammation. Other things that can cause it is like antibiotic use.
That's right.
That's a very common reason why people get leaky gut. A lot of those things cause, dysbiosis. Hello.
Dysbiosis.
Yeah,
yes.
yeah. I was like, there's another one.
I was getting ready to ask you
Dysbiosis,
next, like if you can explain dysbiosis, because I have dysbiosis. So, and I'm like, how the heck did I get dysbiosis, and what is it?
Yeah. Dysbiosis can increase leaky gut. And if you don't fix that, then you're just going to get it again. So dysbiosis is basically like like you have this ecosystem that's supposed to have like trillions of bacteria in your gut, and they're supposed to be playing friendly together. But sometimes you get an overgrowth or too low of the good commensals. It's just imbalance, basically. Dysbiosis is an imbalance of your gut microbe.
Okay.
Yeah.
I see. So for the fire department, we do everything wrong. We eat as fast as we can. We're trying to
this is terrible. Oh my God.
Poor sleep, because we're going to call us throughout the night. High stress, ton of caffeine. I mean, it's like...
Yeah, all of those things are disruptors for that too. But the nice thing is your body can heal. You just have to work on healing it. So the constant eating on the go and the stress and that stuff, if you don't manage that, then you're going to have persistent issues. But you can heal it if you start correcting. You just got to be mindful about how you're doing things. Like I tell people, because I think in our lives are just so busy. So a lot of us eat on the go. I work in the ER. It's the same thing. But if you just take like 3 deep breaths before you eat, sit down, take 3 deep breaths, and then start eating, that'll help slow you down a little bit.
I'm working on that. I remember you told me that.
Yeah. So otherwise you'll still get it.
Right. So, okay. So I had staph. And that was caused, you believe, by dysbiosis, leaky gut?
Yeah. You had an overgrowth of staph.
Okay.
Yeah, you had a little bit too much in that. I think that's what we kind of attacked because that's that's something that can contribute to having psoriasis. So
okay. So the question is from there, with staff that I get from like guys at work and people I tell my story to, just get on an antibiotic, kill it.
Oh no. Yeah.
But that doesn't work.
No, because the thing is when you use antibiotics, it doesn't just say, hey, let's go out after the staph. It kind of takes care of everything, like your good bacteria. It diminishes everything. And we don't know how long it takes for your gut to start repairing again. So there's damage that's done. And I'm not saying that avoid antibiotics at all costs. They're life-saving for a lot of reasons. In a lot of conditions, but I do feel like they're overutilized. I work in the ER. You're in emergency medicine too. People are on antibiotics for everything. Yeah. Like your kid comes in for an earache, you get antibiotics. Yeah. You have acute bronchitis is the most common thing I see people come in. It worked for them before, so they just take a course of antibiotics. Or sinusitis is another one too. Sinus infections, they take antibiotics, and 90% of these things are viral. Antibiotics only work for bacterial infections. That's right. So, but they think it helps them feel better, and they are concerned that they're going to get worse, or they just want to knock it out. I hear that a lot too.
Well, we're kind of programmed where it's like antibiotics. Yeah. No one is really looking in the functional side or the holistic side of medicine. And that's like what I love about the integrative medicine side is like it goes against a lot of like the Western thinking of just throw medication at it, put a Band-Aid over it, where like you're getting to the root cause. And that's what I tell people about you. It's like, no, Dr. Tanya can get to the root cause. Just let her have a consultation, let her do a thing. Yeah. So my 2-year-old with an ear infection, we should not have him on antibiotics.
Ooh, there's a wait and see.
It was for an ear infection. So
here's the thing. That's a good point. Okay, so when it comes to multiple things here. Your 2-year-old, right? So with ear infections, we don't test if it's bacterial or viral. So the recommendation is to kind of wait and see, because the majority of these things are going to take care of themselves and your body will just fight it off. I mean, you have an immune system. It's going to try and, fight off infections. If it persists, usually what we recommend patients when they come to the ER is if the symptoms persist, like they're still having pain over 2 days, then start the antibiotics, because there is a serious condition where they can get mastoiditis from it. It's rare, but I've seen it. And you don't want those things to happen. And it's hard to predict who's going to get that and who's not. But if it goes away, then, the kid's not complaining, the fever's under control and everything, then it's probably viral. You have to weigh the risks and benefits. We were talking about that before starting this right now, that you're in the early stages of from birth to about 3 years old, you're building the foundations of your gut. About 3 years old, your gut starts to resemble that of an adult. But when you're building the foundation, imagine your 2-year-old, it's still building their foundation, and then you give them a course of antibiotics, you just wiped out their gut microbiome, and then that puts you at risk. And we know this. There's an associated risk of higher rates of asthma, autoimmune disease, eczema, obesity, and things like that. And I'm not saying don't ever use antibiotics, avoid them at all costs. It's just don't use them liberally. Yeah,
exactly. I mean, that's the last thing I want to do is get my 2-year-old asthma, autoimmune disorder, or lead to childhood obesity. And that's something that no one's talking about. So.
I know. There still needs to be a lot of research in the area. The research in gut health is still growing. They're finding things. One thing I heard recently is improving the gut microbes of someone with Parkinson's disease actually really improves their health. It's a newer part of research. The other things are cancer related stuff. So colon cancer, they're looking into that, what could be causing it. So yeah, I think we still need more research on it.
Yeah, for sure. How do you feel about colostrum?
I like colostrum. I use it. I have patients use it too. It's very helpful. I think a lot of, I think a lot of people probably need it.
Okay.
It's very helpful. I love it. Yeah.
Because we have it in our Awaken supplement.
Yeah.
We had a colostrum, the functional mushrooms, collagen peptides, and then
all good stuff.
the cocoa flavonoids for your heart, which is really good, stem cells, and then also
NIH?
NIH, thank you.
Yeah.
So the NIH did a study that females who took cocoa flavonoids at 320 milligrams for 25 weeks, it was a double-blind study, saw a decrease in facial wrinkles and fine lines.
Ooh.
So it's another plus for cocoa flavonoids.
Yeah.
So we put it all in one bag, Awaken.
Yeah.
So
I love anything when you can put, a lot of times you have to take supplements so separately. And I love some of these longevity ones where you could, especially like your guys' product, to put it all in one. Cause oh my gosh, like I don't want to have a cereal bowl of supplements, you know?
Right. Well, that's why we created the Ageless Cocktail. Yeah. And I know you're one of our original supporters. So
I love that stuff. It's so good.
My brother was mixing all these supplements together, and I think it was $250 on Amazon to create all these supplements he was mixing together. And I said, why don't we put it all in one bag, but high dose? And we never wanted to create our own business or a brand. It just kind of happened because I'm like, why is no one doing this?
Yeah.
We're the only ones who's offering 1,000 milligrams of NNM, 1,000 milligrams of resveratrol, 520 milligrams of NAD, all in one scoop. So.
Yeah. I sent my patients all of that
That's
for
right.
Christmas.
I remember that.
Yeah. I was like,
thank you.
Tanya, thanks for that big order. I was like, yeah, dude. And they loved it. Yeah.
Awesome.
Yeah.
So since then, I don't think we've told you about it, but we created Ageless Reserve. So the Ageless Reserve is a non-flavored version of the Ageless Cocktail. But this time we made it in 30 little to-go packs.
Oh, nice.
So I'm going to take this right now. This is my third time taking it today.
No, I'll take it too. Let's do it.
Yeah, so we still have the high dose of NAD.
Wait, this is tasteless?
It's flavorless, yes. Non-flavored.
I think I want that one.
Okay.
I think I'm going to keep this.
Okay. I'm going to give you this whole box, so you can keep it.
Fine.
Yeah. I'll give you both.
Take it. Yeah.
So we added NAD liposomal. So both of them have NAD liposomal, which is better absorption.
Oh, wow. So you changed it up a little bit.
Yeah.
I love that.
And I'll throw one of mine too.
Oh, you're going to double.
Yeah. This is
double dose.
My third serving of Ageless Reserve today, and my second serving of Ageless Cocktail. I'm obsessed with mitochondrial health and NAD.
Same.
I think
your mitochondria is actually doing pretty well. I saw your, we did a organic acid test on you before.
Oh, that's right.
Yeah. That talks about a lot about energy and stuff.
Was that the oats test? Or?
The oats test, yeah. Organic acid. That's a really good way to find out your mitochondrial function.
Really? Okay, I didn't realize that.
Yeah.
So my mitochondrial health is good?
Yeah, it's pretty good.
Right. Perfect. It's working. Good. That's not bad considering high stress, poor sleep,
yeah.
being a dad.
Yeah, you recover though. You do well with recovery and stuff. Cheers.
Cheers.
So tasty.
Thank you. Yeah, it's funny, when Mike and I created this, we're like, why is no one putting all these ingredients in one bag? Just convenient, easy to use.
I know.
So, we have our parents on it, and my parents have seen a big difference with their energy levels. My dad has seen really good results with his facial skin. But we're obsessed with mitochondrial health, and poor mitochondrial function leads to disease,
everything,
cancer, everything.
Yeah, you got to keep your mitochondria healthy for sure.
Speaking about mitochondrial health, so I follow Dr. Trevor. I send you a lot of his stuff
on
YouTube.
Yeah,
so he talks about the three biological failures, why people die. And it's chronic inflammation, insulin sensitivity, and poor mitochondrial dysfunction or mitochondrial health, ATP bankruptcy. The mitochondrium produces ATP, which converts everything into energy. Part of the reason why I'm obsessed with my mitochondrial health. But Mike and I, we had lunch with one of the guys at my church who did 30 years in cancer research. And I was picking his brain about why people get cancer, besides environmental reasons. It's not it's your turn to get cancer now. You're a lucky number. There's a reason why. And I asked him about the three biological failures of chronic inflammation, insulin sensitivity, and poor mitochondrial health. He agreed. He said that they tested the mitochondrial cell from people. It's a very expensive test to do in a laboratory. It's very delicate. But there's something called the Warburg phenomenon. So the Warburg phenomenon is when cancer thrives in glycosis and sugar fermentation. It gets hijacked by primitive but powerful energy pathway that supports rapid growth, survival under stress, and immune invasion. The phenomenon is called the Warburg phenomenon. So it's interesting because the way that you can combat it is increasing your mitochondrial health with like NAD, the peptide MOTS-c, 5-amino-1-MQ, which turn on the AMPK pathways. That's like the master switch for your metabolic health and attacking your mitochondrial health. So, but if you have anything on it, I'm all ears. But I just thought it's interesting.
Yeah, I've never heard of that, but yeah, I like that. Yeah, cancer is unfortunately like there's a lot of things that contribute to it, but obesity, mitochondrial dysfunction, insulin sensitivity, it's big on that for sure. I agree.
And then you have my mitochondrial report.
I do, but I have to review it again.
Okay.
I don't know it off the top of my head.
No worries.
Yeah, for sure. You know, one thing that you brought up I thought was really good when you were mentioning, you know, conventional medicine, traditional medicine, and functional medicine. I think, you know, there is a bit of a gap and some limitations in our current healthcare system. But, you know, it's not like one or the other. I think people get that a little mixed up. They're like, oh, I just have my naturopathic doctor and that's it. You need both, you know, like if you need surgery, you need emergency care. That's where our traditional healthcare system like thrives.
Absolutely.
But, you know, there's a lot of people like you who are not quite like trying to fight off a disease per se, but they're looking to prevent disease and be healthy. Or maybe they're starting to feel some symptoms and you're not quite there at like that threshold of a disease. And so you're trying to reverse it.
Yes.
But that's where I think functional medicine comes in and integrative medicine is it helps you go from like figuring out why you're having these symptoms, not just looking like, do you have a disease or not? Like, why are you having these symptoms and what can we do to figure that out?
Right.
Unfortunately, insurance doesn't always cover these things. It doesn't cover prevention or, you know, like pattern recognition or anything like that. It looks for a disease and do we have a medication for that? And a lot of the things that come with trying to prevent disease isn't medication related. It's actually diet, lifestyle, and, you know, supplements and doing the right things for your life.
Exactly. Yeah. I'm all about preventative medicine. And it's like, my thing is like, I don't want to be 60 years old in a convalescent home. Like I know I'm not going to live forever. You and I are both biohackers. The goal isn't to try to live forever. Like we're all going to die. We're all going to age, but it's how well we age.
Yeah.
And that's why I love the preventative medicine, the integrative approach. And my thing is like, why guess? Just get tested. Don't guess, test. So like, I work with a lot of guys that walk around with low energy, fatigue, and it's like, okay, well, have you gotten your hormones checked? No. Have you looked into mitochondrial health? No. What's that?
Yeah.
So the other thing too is that I wanted to talk to you about and ask you, because I know you're big into this, is female hormone optimization. So my wife, when she was 34, 35, extremely low energy after our second child, glued to the couch. I'm 6 years older than her. I would run circles around her and just be like, hey, what is going on with you? Like, why are you so tired all the time? I started researching it and digging. And based off of her symptoms, I believe she had low testosterone. So we found a female hormone doctor before you.
Yeah.
She got tested. Her testosterone level was at 15, which, you know, total, yeah. Which for normal, it's like 0 to 100. Obviously, she's on the low end, like closer to like a 60-year-old female. So since then, you know, she's been on the pellets and then a low dose of testosterone injections, been a complete game changer, but also with progesterone, estradiol, and estrogen. But I feel like female hormones is like kind of like a myth. Like, oh, you have to go through menopause. Yeah, sorry.
Yeah, wait until menopause to start replacing it. No, you're right. Yeah, that I feel like one of our biggest gaps in our current healthcare system is actually women's health. And that's kind of why I went into that direction. I never thought I would be working with women, and that's my primary patient population. I thought I was going to be working with biohackers, you know, when I first went into functional medicine. But I just realized that there's so much of a gap for women's health, unfortunately. And I don't know if you know this is interesting. I was telling them back there that women weren't in clinical trials included in that until about 1990s.
Oh, wow. No, I never knew that.
So a lot of things were based on men. And then just...
So female hormones didn't even exist before 1990?
Well, they did, but that was the reason why they weren't included in these things, is because our hormones, our biology, like you guys run on a circadian rhythm. Women, we actually have an infradian rhythm. And that means that our hormones fluctuate not just daily, but throughout the month, because we have a menstrual cycle. Some women, it's about 28 days. I think that's what people typically think of, but a lot of women, it varies. And it is challenging, like, because there's not like you test one day of your hormones, it's going to be different the next day. So when women go in and they're looking to optimize their hormones or even test their hormones, it's super important to figure out what day you're testing on and work with someone who understands that the different days matter. So in general, I usually, like, depending on what age population I'm working with or what I'm looking for specifically, when you test female hormones, should be day like 2 to 5.
Okay.
And then the other time to test is, like, if you're testing the estrogen progesterone ratio, would be like 5 days after ovulation. So you do have to know when you're ovulating.
Yeah.
But yeah, you're right. Women's hormones change. There's perimenopause and then there's menopause. And during perimenopause, I think there's this huge gap in care because, just like your wife, like, perimenopause can start as early as 35. And people don't realize this. Like, the average age of menopause in the US is 51, about 50 years old. And the age range is 45 to 55. And you can start in perimenopause anywhere from 7 to 10 years before that.
Wow.
So if you have menopause at 45, and of course you can't predict the future, you don't know when you're going to have it, but if you might have it at 45, your symptoms may have started as early as 35.
Wow.
Isn't that insane?
No, it makes sense. Totally.
Yeah. And so when these women are coming at and having like fatigue and brain fog, anxiety, low motivation, you have to look at, you can test your hormones despite what people say. You can test them. There's different ways of testing them. And a lot of times why, you go to your practitioner, your OB-GYN, or your whoever, and you ask them to test your hormones, they say it doesn't matter, or there's no reason because your hormones fluctuate every day. They're not wrong about that, but there's still a reason to test. Like, for one, is trying to rule out any other causes. Like, do you have thyroid issues or nutrient deficiencies that are causing your symptoms? And then going beyond that, like, if your symptoms are cyclical, then you might want to use something like Mira, where you can actually track your hormones throughout the month. I love that app. I use it on some of my PCOS patients or patients who feel like their hormones change. Like, there's a certain time of the month where they have the worst of their symptoms. So we use Mira to track that.
Interesting. I didn't know that. I'll have to share that.
Yeah.
Yeah. So, okay, good to know. Because my wife, she got her blood work done on day 3 of her cycle. So that's good.
That's good.
And then I remember the female hormone specialist, she was like, when you get on testosterone, I call it GST. You're going to get stuff done. You're going to be like a man and be motivated to get stuff done.
Yeah.
And it sounded funny, but it's true. It's like dead on. Like, it's a completely different person. And like, she does her shot once a week. And like, as we get closer to that once a week, she's like, oh my gosh, I can't wait to inject. Her sleep is so much better. Motivation.
Yeah. Why doesn't she do it twice a week then? Because then it'll like, it's more.
No, I agree. So that's what I do. And that's a really good point. I didn't even think about that. I should bring that up to her. So
just split it. Yeah.
Yeah. So I do a split dose. And the reason why is because testosterone is like insulin. So you get a spike and then it drops off.
Yeah.
And I talked to a nurse practitioner who wrote his thesis in men's hormone optimization. And then I also spoke with a doctor who has a hormone clinic. And they all agreed the split dose or like a microdose of testosterone, like 4 to 5 days a week, a very small amount to keep your testosterone levels even, no spikes is good. I didn't even think about that for my wife.
Women, their testosterone tends to start dropping after in their 30s. And I think that's important to know because that does have to do, I've been on calls with women and they'll say that their motivation is not there or they can't keep up with their kids. Sometimes the reason why their testosterone is gone is because they've been on birth control for so long.
Yes.
A lot of people don't know that birth control can do that. It just basically overhauls your
wreaks havoc on female hormones.
Exactly.
Yeah. No, for sure. Yeah.
Yeah. So I don't know. My testosterone is very low too. I've been trying to naturally bring it up, but I think I eventually will go on testosterone myself shortly. I've been trialing a couple of things first. One, I was using DHEA, which really helped my DHEA, but did not translate to testosterone very much. Because, the reason I went in that direction was because DHEA, it's a pill, it's easy to take, and I could do it daily. It did help me a lot feel better, especially with my adrenals issues, but it did not help with my testosterone, like went up by 0.1.
Yeah.
And so the next thing I'm trialing right now is kisspeptin.
Oh, yeah.
Yeah. So I'm going to see what happens. I have to retest still.
Okay.
So,
how long have you been on kisspeptin?
About a month.
Okay. How do you like it?
I mean, I feel good still. So I have to retest. Like I need data, you know? So I'll have to see how it goes.
So the research I've done on kisspeptin is interesting. So it's like a hormone regulator for men and women. So master regulator for both. Yeah. But for females, it also increases libido by, I guess, like similar to PT141, where like it creates not like the plumbing to work better, but more of like the mental aspect of like the desire. I think it's helped me. Okay. Yeah. Good. I think I agree with that. It's been good for me, I guess. Awesome. Yeah. So on our website, Rejuvenate Peptides, we put a female bundle together, female libido bundle, which is kisspeptin, PT141, and BPC157. But good. I'm glad it's working. Yeah. Awesome. Yeah, so I also do DHEA. Thank you. Yeah. Same thing. Like it's great. I see it reflecting on my blood work. Yeah. But it hasn't really affected my testosterone. Like just on the blood work part of DHEA, like it shows that it's elevated or it's low when I don't take it. But yeah, it's supposed to be a precursor, but it doesn't always translate to testosterone, unfortunately. So. And are you taking it in the morning or at night? In the morning. Okay, good. Yeah. Yeah. Same. I was doing it at night, but it was messing with my sleep. Oh, does it? Mm-hmm. No. Yeah. That's it. I take a pretty high dose too. So 25, which isn't usually recommended for females. Like that. I mean, it depends on the person. You have to be careful with like DHEA and other androgens because it can, for some women who have this genetic predisposition, they can get things like male pattern baldness, and it'll increase their DHT, which is more potent. So for females, they might not want that. It just depends. I don't think I have that, I don't think my genetics are putting me at risk for that kind of thing because I feel like I have not had a problem with hair loss and I'm a pretty high dose. So. Awesome. When it comes to testosterone for men and women, I feel like we're in a testosterone epidemic with the microplastins, the stress EMF, too, though. Stress. I work with some men who, even when you replace the testosterone, like these guys are in like their 30s and, even in their 20s, their testosterone's dipping. But there's a lot of reasons that happens. And part of it is stress. And people don't realize that stress plays a huge role in your body. Because think about it. If your body is so stressed, like it's in this fight or flight mode, the last thing it cares about is reproduction. That's right? True. Yeah. So then it's not concentrating on your sex hormones. It's focused on, survival mode. And so your cortisol spikes and your thyroid gets actually out of balance. But all of these things affects your sex hormones and they just drop. Interesting. So I think fixing that is part of like what needs to happen for a lot of people. Okay, so that's a good point because I just sent you a friend. We're testing all of those things. Okay. We're going to test his adrenals. We're going to test his like cortisol. Like what is it doing throughout the day? Because a lot of people, when they get their cortisol tested, a lot of times they'll go and get a blood test. But remember, your blood test is like a point in time. Your cortisol is supposed to spike in the morning, and that's what wakes you up. And then it's supposed to slowly decline as the day goes on. But I have seen people, when I do the 4-point saliva test, they will have cortisol like up at night. And then they are wondering why they can't sleep. It's like, because it's spiking in the middle of the night. Yeah. So we're testing that on him. We're going to do, he really wanted a gut health test too. I was pushing that. I'm like, you need to get your gut checked.
Yeah, he's had gut issues for a long time, so that could be part of why he has brain fog and fatigue too. Like when you have like dysbiosis or leaky gut, you get all that inflammation that's just sitting there, and you're gonna feel fatigue. So we're doing that, and I think there was another test we're doing. Oh, blood test, because I do want to see what his levels are. When we were talking about testosterone, I know you mentioned your wife's total testosterone, but what really matters is their bioavailable or free testosterone. Right.
And that's what's freely flowing to the body. That's what I remember. Okay.
Otherwise, because if it's bound up with the SHBG, sex binding hormone globulin, then that's the problem. And you can't see that with total testosterone. So
I see. It makes sense. That's a good point. I mean, yeah, so he's our age. He's 40, 41, married, 2 boys, works full time, and then he has a business that he manages, so under a lot of stress. And then on top of that, he trains very hard, has a personal trainer. And the workouts that he was telling me, I'm like, oh my gosh, like sounds horrible. Sounds terrible. Yeah. Overtraining for sure.
I can't wait to get his test back.
Yeah.
Give him some direction. Yeah.
Right. Absolutely. Hey, I'm excited for him. So I know he's going to have good results.
Yeah. It's easier to coach somebody when you have that data to be like, hey, here's your thing. Here's what's going on with you.
Right.
For sure.
Yeah. One of the things too, because we're talking about inflammation, I keep bringing up KPV. So KPV, I don't know if you've experimented with it. It's a powerful. Okay, you do? Okay.
It's really good for the gut. KPV, BPC, those are really good gut peptides. Lorazepam too is actually excellent as well.
Okay, I haven't looked into that one. I need to research that one. But,
that helps with the junctions, like the leaky gut part.
Okay.
So I mean, they all kind of do, but that one specifically is really good for it.
I'll add that one to the list.
Yeah.
But yeah, so I've been injecting KPV and BPC 157 in the same syringe just to limit my injections. But I had tennis elbow on my right elbow for like 10 years. So I've been injecting into my elbow, and within 2 weeks, took away the pain. I couldn't even do like a bicep curl or hold my son. Yeah. So I can't imagine like how good it is for my gut too.
Yeah.
It's making my arm feel better.
Yeah. I mean, well, BPC is like derived from gut juices. So
yeah, body protective compound that comes from the gastric intestinal juice or lining.
Yeah, exactly.
Awesome.
So it works to heal. I love peptides because it's kind of natural.
Yeah.
I mean, they're synthetically made in the lab, but they're
short chain amino acids that are
natural
just
sources, low risk profile, so.
Yeah, absolutely. So I brought you 2 gifts. So
oh my gosh.
For Rejuvenate Peptides, we created our own nasal sprays. So for this one, we have a combination. It's called the Clarity Spray, and it's a combination of C-Max and Selink.
Oh, I love that.
C-Max and Selink are really powerful for anxiety, depression, mood stabilization. It helps me because I have ADHD.
Same.
C-Max has BDNF, which is the brain-derived nootropic factor, which is like Miracle-Gro for our brains. So I gave you some earlier, and I think it's working.
I know. I feel better. I do feel more clear-minded and more relaxed also. Yeah. Maybe because we've been talking for a while as well, but
right.
Yeah.
But what's great with the nose sprays is that you can take it on the go, or if you don't feel like injecting, just a couple hits and you're good.
Yeah, I love that.
So the other one I brought you was tesamorelin, and I think you were interested in that one. Tesamorelin is another great one for muscle building, visceral fat, and there's also a cognitive effect to it as well. So tesamorelin is a great peptide.
Yeah, that one's for my dad.
Okay.
Yeah.
Awesome. Got the whole family on it.
Yeah, I do have my whole family on peptides. They're very helpful, especially the GLPs. I actually have most of my female patients on GLPs because, oh gosh, like when we're talking about perimenopause and stuff, like when it comes to female hormones, it's not just estrogen and progesterone. Like they all interact with thyroid and insulin and all of them. And so the GLPs work, so many people come to me and they're like, oh, it's a weight loss drug, but it's more than that. It helps with inflammation. And it's, to me, like these peptides are like signals.
Yes.
And they help re-signal things in your body. So when you don't have I look at hormones like they're an orchestra. And when when they're playing together, it's like a symphony, right?
Yes.
But when you go into perimenopause, it's like one of the band members like quit or, there's like a disruption and now they're playing out of sync. And what needs to happen is you need to like rewire the signals essentially.
So it's a nice choreographed play. And
Yeah,
everyone's operating on the
getting
same
back
play. No, but
exactly.
that's what I tell everyone. It's like once your hormones are dialed in, the peptides work so much better.
They don't work without it. Then.
Yeah.
Yeah.
I mean, because like we've talked about this. Like I've had people I work with, and you have patients where they're on a high dose GLP and they're not losing any weight. And I remember asking you why, and you said that it was because of the CRP or the CPR. That was off.
Yeah. CRP, they have high inflammation. That's because with weight loss, it's not just one thing. It is multiple things. Like if you have high inflammation, if you have insulin resistance, stress, your cortisol levels high, then you get that like belly fat. Because for instance, when you're stressed, your body's in fat storage mode. It's like, I need to reserve energy as opposed to, I'm safe. I can let go of this energy.
So you were talking about like peptide therapy and hormone optimization working hand in hand and inflammation. And once you fix with a CRP, once you fix the inflammation, that's when the weight just starts falling off.
Yeah. These peptides need a place to land. You can't just like rely on these things to just do the work for you. You still have to put in the work,
right?
Especially I feel like some of these peptides that are for optimization, like the growth hormone stuff, like the CJC, ipamorelin, tesamorelin, these ones, they specifically need like a good environment for them to work. The GLPs, some people have resistance because of their genetics. Some of it is also because they have other issues, like other hormone dysregulation going on, like the elevated CRP. CRP is like an inflammatory marker. And so when that's high, that means there is inflammation going on. It should be less than 1. And some people have 2 or 3, or I have one patient whose CRP is like 11.
11?
And she's leaving at that. If I saw her in the ER and she came in for like whatever infection, like that, I would be admitting her, but she just lives at that.
That's crazy.
Yeah,
I can't
it's
imagine
so crazy.
walking around with that high of an inflammation.
Yeah. So we're working to reverse that.
Wow.
So, yeah.
Yeah, like I like what you said. So like the GLPs, the weight loss part of it is just a side effect. Where the GLPs, like retatrutide, is like affecting mitochondrial health, reducing insulin sensitivity, reducing inflammation. So my parents, they're approaching age 70, and we have them on a full peptide protocol plan, which is like retatrutide. We have MOTS-C, 5-MeO-1-MQ, tesamorelin, and then epithelon for sleep. But my dad, who's approaching age 70, 5 years ago, when his hormones weren't really optimized, since then he got on TRT. He went from like, I'm dying, okay, this is my last year. Okay, we got his hormones dialed in. We got the peptides dialed in. And now he's like, oh my gosh, I love this. Like, I feel like I'm in my 20s again. Where's this been?
I love that.
I never want to run out.
I love
and I'm like,
that.
Dad, welcome to the world of peptides.
Yeah, I love that. I feel like a lot of the optimization is a little easier for men. For women, it's like, it is a bit more challenging. That's why I do the work that I do, because, there's a lot more hormones to try and balance, and along with peptide therapy and stress reduction and all that stuff. So
right. So with your integrative health, ageless medicine, okay, we have the GI gut map. We have hormone optimization. What else do you offer your patients?
So, I run a telemedicine practice. It's called Ageless Functional Medicine. And what I do there is basically help people optimize their overall health. And it's very holistic. So we do hormone optimization. I do peptide therapy, and we do gut health. We do genetic testing. What else do I do? Yeah, like weight loss. I should say that. Yeah, I do a lot of weight loss, actually, And my primary patient population are usually women 40 and over who are trying to look for help, essentially, because they don't know why they're gaining weight. They get this, like, what they used to do in their 20s and 30s is not working anymore.
Right.
for their weight loss. And they're like, why am I suddenly getting this belly fat? And it's not a lack of effort for a lot of the women I work with. It's a signaling issue. And so I do use peptides to help with that signaling, and then also balance their hormones, and then also fix their gut. So it's a holistic approach to the whole thing, so that women can also, like your dad, who feels like he's in his 20s again, I want my patients to feel like that too.
Exactly.
So it just takes a little bit more finesse and effort and coaching. But I love working with my patients for that reason.
Yeah, that's why I love functional health. It's because the answers are there. And
Yeah,
it's
they're
like,
there.
It's like we don't have to listen to doctors that say, hey, here's the medication. Let's take this for the rest of your life. It's like, no, the answers are there. You have to search for it by functional health. And I love the holistic approach. So that's awesome.
Yeah. I tell my patients to utilize their doctors and go in, get these labs. I know a lot of doctors probably hate this, but I'll give them a list of labs to go in for. I know people hate that, but the labs that I'm asking for aren't complicated. It's just, your nutrients and your hormones and stuff, and whatever they don't get, I help them fill in the gaps, because I think there's some things that I think are traditionally ordered, like for instance, a lipid panel. They're not ordering ApoB like they should.
Yes.
They're not doing particle sizes and things like that. Those things I think are still, there's some doctors that are ordering that, but not all of them. And that should be on your panel every year.
Right.
There are certain things that should be.
That's a great point, because I remember 2019, my LDL was at 210, and the doctor was like, hey, I'm going to put you on statins. I'm like, absolutely not. There's no way. I'm not going on statins. Not with the side effects for the cognitive. And 2019 was, 8 years ago. Yeah. No way. So I remember I came to you and I showed you my lipid panel, and same thing. My LDL was 215.
Your ApoB was
ApoB. You had me get tested for ApoB, and it came back clear. So we're good.
I think that's what matters too. It's a lot of people they look at their cholesterol and it's oh, it's high, their total, but they're not looking at the HDL or the breakdown of things, and I think that matters too.
And are our brains made of fat? And
it is
function. At least I do. I function so much better off high fats, high protein, lower carb.
Yeah. Everyone's different. I will say, people have a genetic predisposition for certain things. For instance, APOE gene. You've heard of this?
Yes.
Yeah, it has to do with Alzheimer's. So if you have 2 4 alleles, your risk for Alzheimer's is 80%. It's up to 80%. It's pretty high. And remember, when it comes to genetics, your genes are not your destiny.
Yes.
Your lifestyle and everything plays a part in it. And so it's epigenetics that determine whether you turn on and off these genes. And that has to do with your nutrition, your lifestyle, your environment, toxin exposure, things like that. All of those play a role in it. And I personally have a APOE 3 and 4 gene. And so I don't process a lot of fats and things like that very well. It actually does affect my cholesterol. So if I were to do something like a keto or carnivore diet, this would actually be a high risk for me.
Interesting.
Now, your genetics are not the same. I saw your genes. You actually process it very well. Right. You have is it okay if I share
absolutely.
your data?
Yeah, no, absolutely.
Okay, you have a 2 and a 3 allele. 2 is the best.
Really?
It's as good as it gets. 3 is it processes it average. And 4 is it doesn't process well. That's why if you have 2, because you get one from your parent, one from each parent, your mom and your dad. And if you have 2 4 alleles and you don't process this well, your risk for dementia goes up. And so diet is a big deal, and lifestyle is a big deal for those people.
Absolutely. Yeah. So you talked me into getting this genetic testing.
Yeah.
So the genetic testing is 3x4, and you were you explained to me how you're predisposed to Alzheimer's. Yeah. So that's one of the reasons why I wanted to get checked also. But you also explained how in depth this genetic testing was. Yeah. So I did it, and a lot of the stuff that was on it, I was like, wow, that's pretty accurate to how I feel. Just like I said, I feel like my body and my brain react better with high protein, higher fat. Yeah. And my genetics showed that. Yeah. And like you said, in the genetic testing on mine, it said that I have a low predisposition to Alzheimer's dementia.
Yeah. Yeah, your genes are interesting. And you're already doing the right things in general by living healthy. That's why most people, like if they just do the foundational stuff, like get good sleep, eat whole foods, those kinds of things, it's going to help majority of people, but what I like about having these genetic tests, especially this one, is it gives you actions. Like if you had an issue with something, like it gives me an idea of what's going on in your body and why you might be having that issue. So it's kind of like a blueprint of how your body functions. So if you have high inflammation, if you have like histamine issues, like it says in your genetics, like it doesn't diagnose you. You get that diagnosis from, your dermatologist who said you have psoriasis. But why or what could help those things might be based on your genes. Like quercetin could be very helpful for you based on I know we didn't go over your genetics just yet, but we will soon.
Yeah, I'm excited.
I did peek at them, but I'm going to meet with a geneticist to like fully review it with them. So
awesome.
Yeah, I'm excited for that.
Yeah, I'm excited too. I can't wait.
Yeah. Yeah, I love genetics. I think it's a great part. It helped me figure out what supplements I should be using or what diet and lifestyle things that are going to help me. I used it also for a patient who she has a lot of weight loss resistance and she is in a high dose of GLP. And she's one of my only patients that is that high of a dose. And her CRP is also the one that's like 8. So there's a lot of things going on there. And so I did the genetic testing to figure out like what we can do for her inflammation, So that helps me personalize things more to her. That's what I like about genetic testing.
Yeah. I'm really interested in like what it comes back for my supplements because all of the supplements I take right now are based off of my blood work.
Yeah. Which is
where
good.
I'm deficient. Yeah,
still good.
where I'm deficient, and it's helped. I've seen the reflection on my blood work. For cholesterol, I lowered it naturally using a high dose omega-3 fatty fish oil.
Perfect. Yeah,
so
that's
between
good.
3,000 to 5,000 milligrams every day, 5 days a week.
That's in your genetics. It's recommended too.
Oh, perfect.
I looked at that.
I'm right. I'm doing it right.
Yeah.
And then another one that I did was a red yeast supplement.
Rice, yeah.
I bought at Sprouts, and my integrative doctor was like, that I get my blood work done through. She was like, how did you do this? And I'm like, it's just the supplements. But I've tried every diet. I've done like raw, I've done vegan, intermittent fasting. I've done the carnivore, as you know, and I just feel like I keep saying, like my body just responds better to like the higher protein, higher fat.
Yeah. Yeah. You do got to feed your gut microbiome though. Like
I know.
With fiber.
Right.
You do need to feed them because the thing is like we were discussing earlier about, leaky gut coming back and dysbiosis coming back. If you don't feed the good bacteria, the opportunistic ones are going to take over and they're going to cause some of these issues. So like you're mentioning, I think you did a repeat GI map and saw Pseudomonas and the parasite got your parasite got worse, or more overgrown.
Akkermansia was still low, even though you had me on a high dose Akkermansia supplement.
We could talk about a little bit of why that is. So it needs the environment to thrive in. So if Akkermansia, when you take any kind of probiotic, people think that it's going to colonize the area, but it doesn't do that. It goes in and helps perform a function. Okay. Akkermansia is going to help. But if it doesn't have the right place to land, it's still going to die off.
Yeah.
Like if the dysbiosis is taking over, it doesn't feel like it's not getting the food it needs. It won't just grow on its own. It needs the environment. So that's why fiber, there's really good research on, the higher fiber intake that you have, it decreases all-cause mortality.
Wow.
Probably because you're feeding the good bacteria and it's improving your immune system,
Interesting. So how do you recommend fiber? Like what's the best way to take it?
So, best is like from foods, of course. If you're majority of the US population doesn't eat a lot of fiber. Like we get a lot less than we should. So if you're someone who gets like 8 or 9 grams of fiber a day, which is, I think the majority does, you need to increase it by 5 grams per week and see how your gut feels. Because if you go from like, you really should be eating 25 to 30 grams of fiber a day.
I'm nowhere near that.
Yeah, I know. Most of the population is not.
So do you recommend like an oral supplement, or you saying food is the best?
Food is the best.
Okay.
Like getting it from plant-based diets. They've done studies on this. I mean, even if you look at the blue zones, have you heard of the blue zones?
Of course, yeah.
Yeah, the people who've lived the longest,
Right.
they have
but there's one common denominator with the blue zones.
What?
All of them walk.
Yeah. That's
all of
good.
them walk. All of them get outside and get sun.
Yeah.
But go ahead. Sorry.
Yeah. But they all have a very high plant-based diet.
That's true.
So, and you're supposed to try and get like, or at least what they did is get like 30 different variety of plants. Because if you eat the same fiber every day, then those gut microbes are going to grow, but the rest aren't. You have to give it a variety so that they all grow. It's all about an ecosystem and balance. So yeah, that's what I would recommend is trying, but not doing it like, don't go from eating 8 grams of fiber to 30 because you're going to get bloating, discomfort and everything. Your gut's not used to it. So you have to increase them, like week by week, like by 5 grams a week, and then see how you feel each time.
Interesting.
Yeah.
Okay. Yeah. So I did a Biohacking a couple years ago. Mike also gifted me a Biohacking, so I did it again. But a lot of the stuff that I was eating like 5 years ago, which made me transition to carnivore, things I thought were healthy, like kale, broccoli, cauliflower, spinach, was bad for my gut microbiome.
Maybe, yeah.
Which could have explained like maybe the bloating, discomfort.
Yeah. You might need to switch it up. Maybe try fruits or something.
Okay.
I
like fruits.
Yeah. It doesn't have to be, you just got to figure out what works for you,
Okay.
Yeah.
Awesome. You have a background working in the emergency room with conventional medicine, and now you're doing integrative. So you see both sides of the spectrum.
Yeah. I think that's one of the benefits that I have is, I get the best of both worlds. Like, I have been practicing in emergency medicine for over 13 years, and I've seen what we can do, and I also know the limitations of our current healthcare system. And then going into functional medicine is where I feel like I was able to help fill in the gap, because, there's a lot of women that I work with, and they talk about how they've already gone to their doctors and they are told that their labs are normal and that it must be in their head. I hear this all the time. They get dismissed. I even hear my colleagues say these things about, oh no, she's just crazy, or, it's in her head, it's anxiety, all of these things. And they just get dismissed, but they don't realize that normal labs do not equal optimal labs, and then the other thing is they might not be, our standard labs don't always look for what's going on with them.
Exactly.
They literally are just looking for a disease. And so a lot of women, they don't quite have a disease process. They just have like an imbalance of something, and so that's why we have to look into that. Like you said with your wife, who after having a kid, she felt like a lot more fatigued and things like that. A lot of that could be hormones. Some of it could be gut health. I know with brain fog, there's multiple factors that play into that as to why some people get brain fog. Sometimes it's like that low-grade inflammation. For me, it was actually thyroid issues. Thyroid is a very interesting topic because, in conventional medicine, when we screen for thyroid disorder, we just use TSH, and we actually give it like a big range where it can be, we'll say it's still normal. But the problem is your TSH could be normal, like actually even optimal ranges, and still you'll have thyroid dysfunction. I know this because I went through that myself. Wow. My TSH was actually 7 or 8, which is really high. The range is crazy. It's like 0.5 to 4.5, which is a wide range. People usually feel normal around 1 to 2.
So were you considered hyperthyroidism, or?
That was actually so here's the thing. My T4 was in normal range. Okay. So why was my TSH high? This is one thing that we don't look at in conventional medicine, but in functional medicine we do. It's like, why is that high? It was high because of a lot of my adrenal issues, my stress. I was working night shifts. And so people don't realize this, but your stress levels, your adrenals, all of that stuff, like will affect your thyroid too. And so when I actually put myself on Armour Thyroid now because I tried optimizing it and got pretty close to a good range with just supplements. I realized that I wasn't converting T4 to T3. And then I started taking some supplement of thyroid or medication really, and it got rid of my brain fog. That and fixing my adrenals. Like I was really exhausted.
Yeah, I remember that time when you had adrenal fatigue constantly. And this is a couple of years ago. I didn't know really much about it. So it's really interesting.
Yeah, adrenal fatigue, not really recognized. It's not truly adrenal fatigue, but I mean, that's the easiest way to kind of discuss it is that, you know, there's a dysregulation in your cortisol. Your cortisol goes from cortisol to cortisone, and it's supposed to, you know, sometimes it gets dysregulated. Your body doesn't clear it that well. We can see this on a Dutch test or saliva testing, things like that, and it helps me put people in the right direction. And depending on what's going on.
The Dutch test is a urine test?
Yeah. I do love that test. There's a lot of people who don't like that test, but I like it for specific people. Like it depends on what their issue is, but a lot of people don't realize like it tells me how your body utilizes the hormone. So when you do a blood test, it tells me, do you have certain levels, right? A Dutch test will tell me how your body is utilizing those hormones.
Interesting.
Yeah.
Oh, I didn't know that. Okay.
Yeah. So it actually can tell me also if you are someone who is at a higher risk for, like if you're a woman and you go on DHEA or testosterone, are you at risk for getting like the male pattern baldness, the hair, and all that stuff? So yeah, it's pretty
interesting. That's a good test.
Yeah, I like it. Yeah.
Yep.
Having your friend do that too.
Oh, he is?
Yeah, he's
good.
gonna do
You guys really are testing everything.
Yeah, we're doing
that's
that.
the whole thing. Why guess? Test.
Yeah, exactly. I think testing is incredibly helpful, but you know, we're limited in conventional medicine as to what tests we can do. And so, because, you know, if insurance is going to cover it, that's one thing. I think blood tests go a long ways if you order the right stuff. But there are some things that are often missing.
Yeah. Well, and like you said, like conventional medicine is just the guideline standard of blood work tests. So it's like, I'll work with a lot of firefighters we have low testosterone. Oh, I just got my blood work done by my general practitioner. My testosterone came back at like 210, and they said that's normal. It's a normal range. I'm like, no, dude, that's not a normal range. Like, you're not going to be feeling your best.
Actually, one of the people that you had sent to me before, who I won't mention his name, but
was he a firefighter?
Yeah.
Okay.
I mean, all your friends are firefighters. Yeah. But and his testosterone level was 300. And this is normal range for a male. 300 to about 900 or 1,000, I think is the range on the lab. But I was like, this is not going to be optimal for you. And he was like, no, my doctor said it was totally fine. I was like, yeah, it is normal, but there's a difference between normal and optimal. Most men are not going to feel good in this range, you know? And so we did free testosterone and bioavailable, all of those things. And once I put him on testosterone, he was like, oh my gosh, I feel motivated to go to the gym. I feel better. I have more energy. I feel strong. You know, he didn't even go to the gym.
Wow.
You know, but now he wanted to because he had motivation. He had no idea. The thing is about like aging, and you see this in, you know, even as a firefighter, I know you see everything too. We're both in emergency medicine. That like there's this decline that happens, and you know, when you're with yourself day to day, you might not feel the decline drastically, but you'll start to shift, and you'll feel like, I don't know, like unmotivated or fatigued. And you think this is just all part of aging, but you don't have to age that way.
Correct.
You can age like and thrive. Yeah. You know, I see people in the ER all the time. There's like 80-year-olds who come in bedridden. They have a tube in their stomach. They have dementia, whatever. They need someone to help them. And then there's 80-year-olds that are coming in for sprained ankle from pickleball.
That's awesome.
You know?
Yeah.
And but in order to be that person who's thriving, like you have to age with intention.
Yes.
And I think that's where people get messed up. They allow natural aging and they don't intervene at all, but you have to intervene, especially after 40. Like you have to start intervening by making sure you're lifting weights, not just like cardio and walking is not enough.
Right.
You have to strength train, especially for my ladies out there. They have to strength train. And then you have to optimize your protein and you want to make sure you're getting in the nutrients because otherwise you will decline. And honestly, like just being in the ER, I know that once you start getting these diseases, it's an uphill battle. It's harder to reverse. It's so much easier to prevent. So when people are like, oh, I'm just going to, guess and live my life or whatever, and they DIY everything without any kind of guidance, you're wasting more time and money, than actually getting guidance, testing, seeing where you need to be and having a plan.
Yeah.
That investment in yourself is so much more.
Absolutely. Yeah. And it's all about how we age and how well we age. And like I see it all the time with my career in the pre-hospital setting, like 50-year-olds, 60-year-olds who are in bad shape on a list of medication, have CHF or whatever underlying medical condition it is, and in a convalescent home. And it's like, I don't want to be 50 or 60 and live my life that way. I want to be like that 80-year-old who's playing pickleball and sprained my ankle.
Yeah, exactly.
That's the goal. It's about, how well we age, but it's preventative medicine. Yeah. Getting the right tests done. Like you said, you nailed it. Weight resistance training, eating enough protein, having creatine, taking it daily, not only for the muscle effect, but for the brain effect. I have my parents on it. And like you said, for the ladies, I tell every woman who comes to us for peptides or for any type of advice, you have to eat enough protein. You have to lift weights for weight resistance training, because especially women, when they get into their 60s, 70s, they fall and they break a hip. It's because of the skeletal muscle mass that they're not retaining. Yeah,
part of it. So that's a good point that you bring up. So it's interesting because like if you fall and break your hip and you're in your 70s, the risk of death in that 1 year, the mortality rate is anywhere from like 30 to 70%. It's a huge, huge rate. I may have misspoken on the percentage, but it's something high and it's ridiculously high. But even if you don't die, you end up being disabled and your quality of life goes down. And preserving our quality of life is what matters, and you have to be intentional in order to do that. Exactly. Having a purpose and being intentional. And like you said, like that mortality of like a 7-year-old breaking their hip, I see the same trend like over and over. It's like they break a hip, they go to the ER, okay, they do surgery or hip gets aligned, then they go into a convalescent home for physical therapy, and usually they don't make it out. That's like the last stop. Yeah, it always breaks my heart when I see it in the ER. And it's like, what can you do? We have the privilege of seeing all kinds of age ranges and seeing, who ends up where, right? Like if you're the different levels of 80-year-olds, like people who are still functional and then people who are not, and I think that motivates me a lot too, because I know that there's a way to be that 80-year-old that's playing pickleball versus being in a skilled nursing facility, and everyone wants to avoid that, but to avoid that, you do have to be intentional. You have to, You're doing it right. I see it. I see you working out. You are too. Yeah. Lifting, squatting. So. Yeah. Always strength training, One thing I wish that that I could have done in my early 30s or 20s when I felt my best is I do wish I knew what my hormone levels were at that time. They tell women that you don't need to get your levels checked unless there's a problem, but I don't agree with that. I would want to know where I was. That way, when I go into menopause, that I have a target to aim for, because then I would know how I felt in my 20s with my hormone levels at whatever. Because right now, the way we do hormone replacement therapy is there's not great research for women. What we do know is that you need at least 50 to 60 on your estrogen levels to protect bone for men and women. And so we aim for that, but we don't know what optimal is for women. Interesting. So when we, for men, when we replace it, we have a target for testosterone. For women, we don't. We're just we were told, if they're even on estrogen, it's like lowest dose for shortest duration. Now, it's no longer shortest duration is the recommendation, but we know that at least between 50 and 60, I think it's picograms per liter or deciliter, that has bone protection. So when women go through menopause and they don't do hormone replacement therapy, they're at higher risk for all of these things, for dementia, osteoporosis, heart disease, because estrogen affects every system in your body, every organ in your body. And a lot of women, they start wondering, why am I gaining weight? Why am I suddenly having diabetes or cholesterol issues? And they don't realize this all happened after menopause. And it's because estrogen plays a role in all of those things. So, 2/3 of women who, or actually 2/3 of people who have Alzheimer's are women. So a majority.
2/3?
2/3.
Wow.
The majority. But Dr. Lisa Mosconi, who's a neuroscientist, is actually, thank goodness for her research, because she's doing research on how estrogen affects the brain. And we know that estrogen right now is not used for prevention of dementia, but there's definitely good research that shows that it can help.
Really?
Prevent that. So I will die with my hormones. I will be with them forever.
Yeah.
I'll always I don't know.
Well, that's one of the things I hear from, guys, is okay, if I get on hormone replacement therapy, is this something I have to be on for the rest of my life? Well, it's why wouldn't you? You brush your teeth for the rest of your life. Yeah. You're taking ibuprofen and Tylenol for the rest of your life.
Yeah.
I feel better now in my 40s than I did in my 20s and 30s.
Yeah.
Same with me.
Yeah.
I'm taking it with me.
It's so interesting when people say that they want to age naturally. I'm like, what do you mean by that? Yeah. For some people that might be, I'm just gonna you're just gonna decline. That's natural aging, really. Yeah. If you don't intervene,
so you're gonna sit on the couch and watch TV and wither away. And that's
exactly
what I saw my grandfather go through. He retired from his job, retired from life.
Yeah.
And that's not how I want my life to be.
Yeah, for sure. I think definitely a different generation. That's one of the challenges I have with some of the women that I work with, is retraining them to think strong, not skinny.
Yeah.
And to have them a whole generation of women who didn't grow up, maybe playing sports, or didn't grow up thinking that they needed to lift weights, that they should be cardio bunnies and that's how you lose weight. And really the best way to lose weight is actually having more muscle.
That's right.
That way you're burning more energy at rest.
Right.
And then just having these women start doing something they haven't done in their whole life.
Wow. So no more elliptical.
Yeah.
Start deadlifting.
You need to walk and do all those things, but strength training is
it's huge.
Huge.
Yeah.
It's huge.
One of the misconceptions too with females, well, maybe it's changing with the generation, but I don't want to lift weights because I don't want to get big and look like a guy. It's
my God, I wish. I wish it was that easy. Don't you? I remember thinking that one time when I was younger, I was in my 20s, and I thought I don't want to, get buff. I just want to have lean muscle mass. But dude, I do want to get buff now, and it's really hard. Yeah. It's really hard to build that muscle, especially probably because my testosterone's a little low. But I wish it were that easy.
Peptides and testosterone will get you there.
Yeah, I definitely need to start replacing probably. So we'll see. What's wild is that a lot of women come to me after 40 and they're wondering why they're gaining all this weight. They used to be athletes, they were disciplined. The things that they used to do in their 20s and 30s are no longer working. And the thing is, it's because their hormones have shifted. They're entering perimenopause or menopause and they don't even realize it. And then they're struggling to lose weight. So they cut calories, they do any of these fad diets like keto or carnivore or whatever worked for someone else, and it doesn't work for them. But that's because they're not understanding that their hormones are shifting. And so I've seen them go through Orange Theory or some high intensity thing, and they're not prioritizing sleep and they're not focusing on their hormones. So they end up actually doing the reverse of what they need to be doing, and it actually backfires on them. So they end up getting that belly fat, and they're like, why the heck is things not working? And they don't feel like in control of their body anymore. So that's one thing that I help a lot of women with, is help the re-signaling in their body and optimizing their hormones so that they feel like they're in control and they can lose weight effectively again.
Yeah, that's perfect. Because I feel like the mentality that we have, or like especially like as Americans or maybe our culture, is just work harder.
Yeah.
Push through it, work harder, go to the gym harder. But that's not getting to the root cause. It's not.
Yeah.
And then you have people and a lot of women saying, I'm doing everything right. I'm going to the gym. I'm tracking my macros, but I still cannot lose this 5, 10, whatever, how many pounds it is.
Yeah, exactly. Sometimes I've had women come to me that told me that they went to their doctor and they said, your labs are normal. They get told that all the time. And then they look at, they give them like a plate and say, you need to eat this much food. And my patients are like, so I don't know, they're offended. They're like, I'm not eating a lot, and then, they, try to cut calories more, and that backfires too, because then your body's like, okay, I'm starving, and their cortisol rises. So they're not focusing on what needs to be done. And that's what I help women do, is I basically help them figure out what exactly is causing your weight loss resistance. Is it hormones? Is it stress? Is it your gut? And then we work to fix that. And that's why they get such great results.
That's awesome.
Yeah.
That's why we love you. That's why I keep telling everyone that I come in contact with about you.
I know. I appreciate that.
Of
for
course.
Sending people over. I enjoy working with people, and I don't know, it's so rewarding to have people tell me that, they feel their best again, like they used to.
That's the best feeling.
Yeah.
And I mean, you had me as a case study that you heal my psoriasis. So
yeah, that's awesome.
Good having you on.
Yeah, thanks for having me.
Of course.
This has been so much fun. We got to do it again.
Absolutely.
For sure.
Sounds
Thanks.
good.